in September. Oh, thanks, Bryce. Some other rankings that we did for strategy 3 back in September were how likely is this to be implemented locally? How likely is it to be implemented locally in the next 3 years, in the next 5 to 10 years, and how likely is it to improve physical activity and health? So strategy 3 was by far the lowest ranked strategy, and it seems to me that it was ranked quite low because it probably won't have a big impact on actually improving physical activity and health. The average ranking was only 1.7 out of 3. The others were actually pretty similar to what we had for some of the other strategies. So when we talk about barriers to success for strategy 3, is there anything in particular that comes to mind? And so I might start up the discussion. Is there any particular reason why we think it is unlikely to improve physical activity and health? Yeah, go ahead.
I was just saying, and I think this will be for both strategies, but that we're talking about is just the time aspect, getting those professionals to take the time to reach out to mass media, and then also for them to know who to reach out to and how to reach out.
Robin, when we say mass media professionals, you're talking specifically about media outlets?
In my mind, I think it's a good question. And to me, when I think about it, I think about certainly media outlets, traditional media outlets. But then I also think about like marketing agencies, for example, either that might be just kind of freelance, doing freelance work, or for individual projects, or maybe if it's things related to the connection to an existing media campaign that might have something to do with physical activity. For example, I don't know, like the Kansas City Royals or something like that. That's kind of what comes to my mind.
Okay.
But feel free to hop in, other people, if that's off base.
No, I just think there's different barriers to each of those. So with traditional media, news, radio, TV, it's just competing with other stories. It's if there are other things more important, it's hard to like pitch a story, a single story, versus maybe partnering with a news personality locally to do a regular series where they're actually participating in physical activity and kind of lending that local celebrity bent to it.
Gotcha. So I actually hadn't thought of that, but I think you're absolutely right. What came to my mind was this document that I was reading earlier today, or actually I started it yesterday, and I put it in the chat. And this is from the National Physical Activity Plan, actually, their mass media sector. They have produced a couple of, I guess, white papers over the past, it's probably 2 years now, about mass media campaigns. And the document that I placed in the chat right now is more than just exercise, media and organizational discourse on physical activity. And it's 24 pages, and I'll be honest, I haven't gotten through it all. But a lot of the things that they talk about is a lot of times when you hear or see a traditional media report, they focus on exercise. So doing some sort of structured exercise that is very intentional in nature. So I'm going to go run a marathon or something like that. Whereas the focus should more importantly be on physical activity, which is maybe unintentional activity that you might do. So whether it's walking to the grocery store to get some food, or doing yard work, or something that's different than traditional exercise, because that has a lot of associations, some negative tied to it. And you obviously, we don't have time to read that today, so I just threw it in the chat for you. And I'm also kind of working on getting someone from the mass media sector from the national plan to actually join one of our future meetings, just to kind of share what they're working on, and maybe talk a little bit more about some of these white papers they've produced. So
that would be great.
Yeah.
Yeah. I think one thing that could help with overcoming barriers would be to have prepared talking points for professionals and have that list of contacts, who specifically, this is who you would reach out to at the Star, here's who you would reach out to for, Channel 41, and having those specific contact information for them.
Yeah, I was thinking that exact same thing when you were talking about time commitment. Is it something like having pre-made materials just that are easy to use and easy to understand available?
I like having things available, or even like a toolkit with just a list of social media posts that they could post when they do have an empty spot that they need something to fill it with.
Mm-hmm.
And I've noticed a lot of the campaigns that I shared last time and in the September meeting seem to do a really good job of that, having not only pre-made messaging, but pre-made videos, photos, things like that. And I know, of course, like professional organizations, they have communications committees ready. So when, let's say, a big research study is released or published, that they have people ready to comment, experts ready to comment on that article for, say, the New York Times or ABC News or whatever. So a contact list, I guess, like you said.
Another thing, Robin, I think depending on, I think we have to pay attention to demographics too, because what some of us may consider mainstream media or those kinds of outlets may not reach the people that we really want to reach. So looking at media that is specifically targeted for Spanish speaking residents, African American community radio, that those kinds of outlets I think is really important if we want to be accessible and culturally relevant.
That's a really great point. And I assume that that's an intentional strategy for Bike Walk KC, because I know I've just witnessed it as I've read some of the coverage, seen some of the coverage. It is pretty challenging though, isn't it? I guess because just to use Bike Walk KC as an example, people still kind of think of like, oh, it's for bikers. It's for the person in spandex on their road bike,
Yep. Yeah, it is a challenge, and it makes it even more important to partner with those communities and take the lead with them in terms of how to get the message out to their constituents in a way that debunks some of that misperception. But more than that, it's about making clear that what the messages that we are sharing really are for everyone. And that just is sometimes trial and error, and just being really honest about, look, where do we start in your neighborhood, or where do we start with the group that you work with? Latino Health for All, Latinos Health for All, that would be a group to talk to, those kinds of things. So, yep.
Yeah, and organizations like Maddie Roads as well.
Yep. And we've got good contacts at both of those organizations through our education folks.
And when you're kind of how Amy is mentioning more non-traditional media, and getting in front of those more diverse audiences, possibly some just neighborhood meetings, neighborhood organizations, and getting the word out to them and their newsletters.
To me, one of the biggest barriers to success here is coming up with the message.
Mm-hmm.
Like, what's the message that's going to resonate? So you're already competing, as I think Amy said, you're already competing with other information people want to hear. And people who care about physical activity care about it whether you tell them or not. That's not the audience that we're really trying to get to. We're really trying to get to those that, to everybody else. And like someone already shared, it's not just about exercise. Like, that's not even the point. The point is moving, stand up, move around, don't sit too long, all of those different things. But how do you come up with a message that's going to resonate with somebody who doesn't actually care about being?
Mm-hmm.
Yeah, the message
moving?
really has to be tailored to the specific audience. it's going to be different, depending on the audience.
Right. And so then
where media approach is difficult.
Yeah.
Yeah, we were talking along these lines, a couple weeks ago, right, Amy, about other the benefits of physical activity beyond physical activity. I'm looking something else up right now, and this is something that I've shared internally with our group, and we think this is a good idea, and have done some work on it, but due to, just capacity issues, we haven't been able to complete them. And this is along the lines of what are some of these other benefits of this example that I shared was complete streets. So they do a really nice job on their website of having these small little info sheets about how the one I pasted was complete streets fighting climate change. So, if you're interested in climate change, then here's how complete streets is beneficial for you. If you're interested in children's health, they have another one for children's health, which I just threw in the chat. And so these aren't, I don't think, media necessarily media media sheets. They're more just fact sheets, but I think you get the idea of having multiple different pre-made packets available for whatever the topic might be.
And we have some of that at Bike Walk KC, some policy briefs where we connect walking and biking to issues like climate change. We have one on housing, affordable housing. So really, yeah, making those connections to show that this isn't just for the marathon runner or the for someone like my husband who's in spandex on his bike for 8 hours every Saturday. So yeah.
Where are those kept at, or where are those housed? Do you know?
Well, I know that actually for the new year that Michael is updating them. So let me, while we're chatting, I will open up and see if he's got those links available yet, and I'll drop them in the chat.
Great, thanks. While she's doing that, maybe we can start thinking about, is this already being done? So I think that there's a couple examples that we just talked about. Complete Streets has some things that are good nationally. Bike Walk KC looks like they have some things that are available more locally. The specific strategy, or the strategy 3, specifically talks about the health benefits, which I think we've expanded beyond health, but I'm not aware of specific resources necessarily around the health benefits of physical activity. Although, there's probably, I'll be conservative and say 60 years of research on this. So there's a lot there, but I'm not sure that there's anything created locally.
Yeah, I'm not aware of anything that really speaks to the health benefits, but another kind of avenue where it could be promoted and encouraged to talk about the health benefits is KC Parks, because they do like a newsletter that goes out to communities about all the activities that are happening in the park, where that could be an area where you could kind of promote to them to kind of, up their messaging a little bit to not only just talk about the activities, like here's what's going on, but why how those activities could impact your health and, help the community.
as you were talking, just another thing that came to mind is some of the cultural festivals that we have. You know, dance is so much a part of so many different cultures, and that becomes one of the highlights of those culture fests. And I think talking more about expressing that, you know, cultural expression is fitness. I mean, there is fitness and health inherent in that. It's health in cultural identity, it's health in physical activity, it's you know, connecting your culture with others. I think there's something about those culture fests that I've been thinking about since our last meeting, where I'm like, there's something there that's already a gathering of so many people, diverse audience, and I don't know where to go with that, but that just seems like that's something that's a pretty big deal. The culture fests are a pretty big deal around here, so that just might be something to think about.
Mm-hmm.
Yeah, you're exactly right. And, you know, I think we've seen it before, where you can have at some of these festivals, there might be specific health-related activities that no one participates in. But then when it's time to do a dance or something like that, or the music starts playing, then they'll participate.
And for some other things that are already being done, I know we have, and I was trying to find it, some locally created materials on how being physically active and not obese can prevent getting some type of cancers. And then we have the Walk with a Doc program, where people can walk around neighborhoods and talk to doctors at the same time, as kind of a information and exercise program at the same time.
Yeah, that's great. If you find those, yeah, feel free to drop them in the chat or email them to us if it happens later.
Okay, I'm looking for them right now.
And I would say Bike Walk KC is something that's already being done, because you guys are promoting the benefits of biking and walking on your health.
Right. And we also try to put that message in terms of you don't have to be a particular body type or shape to get on a bike. Like it's not about you do the biking once you're at some point, you know, that you feel, I don't know, there's sometimes a disconnect between body image and the idea of moving and being healthy, and that you can be, I mean, I'm a larger bodied person, but I can still be healthy. I don't have to be Melinda size to you know what I'm saying? So I think we have to, in terms of not turning off audiences, obesity does not automatically equate with you're going to die tomorrow. And I think folks, larger folks like me, get really tired of hearing that message.
And I want to interject and say that's a really good message that we should drive home, that people body types are different. They're going to process food and exercise different. And so no matter your size or your body type, health is health, and we have to stress that.
Yeah. Yeah.
And I know that's going to be, this probably is getting more into the tactics, but I think once we start thinking of ideas of like sharing stories of people of all body types and some of the things that they do. Because like, you know, with my skating team, we have ladies of all shapes and sizes, and just, you know, just hosting and just, you know, sharing those stories of people of different body types and doing their, you know, favorite physical activity, I think would be a good story to promote.
Yeah, that's great. And I went over to my bookshelf to try to find my book. There's actually a lot of research out on this thing they called the obesity paradox, where actually being overweight in most circumstances is associated with better health outcomes than certainly being underweight and oftentimes being normal weight. So that's often missed. You're right, in messaging.
It's a good book, and I know why you can't find it, Robin. You lent
You
that
got
to
it.
me about a year ago.
Gotcha. I thought that I need to do a better job in tracking my library checkouts here. Got some overdue fines coming.
That's a good book.
Yeah, and I think that really gets to when I first read the strategy, that's kind of what I think of, when we're talking specifically about physical activity professionals, me educating media professionals, you guys, that type of information is often lost in the communication. So and when I guess I'll just call like a quick timeout here and explain a little bit more into the process that we're going through. So right now we're just talking about the strategies. These are kind of broad strategies. In our next meeting, we'll dive more into the specific tactics within each strategy. And so a tactic is a more action-oriented statement. And so we can look a little bit closer at that first document that I shared from the National Physical Activity Plan that addresses some of this kind of, they call it discourse, media and organizational discourse. We can dig more into that document specifically around, some of these things that we're talking about in terms of barriers and how to overcome those barriers. So this isn't the only conversation we'll have on these lines. And so keeping that in mind, I guess, just looking at the time, maybe we'll try to wrap up the conversation around this strategy with final thoughts and then move on to the next one. Anything else people want to add?
I just think other than, this could actually become more effective if we talk through in the tactics some of the more sort of specific communities and reaching out. I mean, I think this has the power to do it if we understand and realize that trying to tap mass media or the traditional media outlets may not be the best route, but if we are willing to get a bit creative and look at some different partners to partner with, this could actually be a really strong area for us in terms of getting the message out and impacting. Sorry, that was the cat. Impacting, she just knocked my pen off the table. Impacting communities and health, individual health.
Yeah,
we just tweak the strategy somewhat, to be that non-traditional, more community-based media outlets.
Thanks for saying that, Melinda, because that's exactly what this process hopefully helps us do is, we start with these national strategies, but, let's tailor it as it makes most sense, for local media outlets or other forms of communication, things like that. All right. If there's no other thoughts, maybe we can move on to the next strategy, the final strategy that we'll discuss. This was actually, strategy 4 is the one that was actually ranked higher than strategy 3. So this one is professionals in physical activity and public health should optimize application of social media and emerging technologies in media campaigns to promote physical activity. And this one, the individual items that we ranked back in September was implemented locally, in the next 3 years, in the next 5 to 10 years, and how likely is this to improve physical activity and health? It received quite high marks for likelihood to improve health. I actually think it was one of the highest, if not the highest, ranking there. Sorry, trying to zoom in here. And the other things that we ranked were pretty similar to the other strategies. So barriers to success. What's standing in the way of optimizing social media and emerging technologies? To me, there's not many, maybe.
Well,
I think it's similar to strategy 3. It's that time commitment and having prepared messages. But I think, like what Ashley had mentioned, if you had a toolkit created for these professionals with, messages already created that they could put on Facebook or tweet, would make it a lot easier and save them time. And it would also be something too where within that toolkit, you could provide a statement of like why it's beneficial for them, getting their branding out and being a thought leader. So putting together a toolkit that gives them the messaging, but then also gives them the why they should be promoting it as well and how it benefits them. It's all about me, don't you know, always. It's what's in it for me.
I think social media is a funny animal because some people are really good at it and some people are really bad at it. So I just gonna be honest. So it will fall flat if you've got a physical activity professional who never is on Facebook, who doesn't know, the difference between a twit and a tweet. Like that makes a difference. So who's delivering the message? Organizations delivering message on social media are not as effective as personalities, individuals who are sharing the information. So I think some of it has to do with choosing the right person to manage that messaging on social media. In order to be effective, putting a canned statement out there and checking it off that we did social media is not going to produce the results that we want. So
those are great points. Yeah, I've certainly seen it that, and I'll just say Children's Mercy. Children's Mercy, everybody knows Children's Mercy. Everybody likes Children's Mercy. I've looked at some of their tweets. They get, like 4 likes and a retweet or something. And, so clearly the impression that people have of Children's Mercy is not from their social media engagement that I think of.
So I think social media is such a powerful tool, but it actually, for me, I think takes more planning and forethought, but still but it still has to come across as sort of spontaneous and custom, right? But it almost takes more brain power to plan that effective social media campaign out than it does to like reach out to mass to the mass media outlets, because you just send out the press release and like they pick it up or they don't.
Yeah.
I don't know, Toriano, you're all over LinkedIn and social media and whatnot. I would love to hear your perspectives on this one. He's busy tweeting.
Yeah, probably.
I think you've got mute.
Or maybe he's at a coffee shop and he's ordering his latte.
Probably.
I mean, what do other people think? I know you guys, most of you guys are all on social media and you've seen messages that have really resonated or connected.
Yeah, I mean, social
Yeah.
media nowadays is just so good at knowing what your interests are with, you know, how data is logged through all these platforms and the internet. So it makes, you know, public health initiatives very difficult to push upon people because it's not going to get as many likes, you know, clicks, and people will tend to scroll right past it. So like you said, you know, customizing the campaigns to improve the, you know, viewability can be difficult when you're competing against things that people are already interested in, or you're competing against these campaigns and promotions that, you know, have a really notable figure in the community, or you know, is related to, you know, a team or a, you know, something else in the community that is more likely to be clicked on. So that's just what makes it hard, you know, through all the campaigns. I think in specifically, it tends on the platform in which people utilize it for. Like LinkedIn, I'm going to get on there with a different approach than if I'm getting on like Facebook or Instagram. The same can be said for Twitter, I think. So definitely understanding what each of those do and how, you know, news outlets also use them, kind of combining traditional media with social media, and kind of when to optimize both of those.
Yeah,
I
Bryce,
think
go ahead.
to Bryce and Amy's point, really like pinpointing who can implement, who would be those influencers, I guess, that would be able to really spread our message and, you know, are relevant to the message as well. So just maybe getting like a list of top 10, top 20 of who we could specifically target, and, you know, people would listen, or we know those are popular, you know, feeds that people pay attention to.
So a lot of the, you know, the local marketing advertising folks, I mean, they have those influencer lists and they work with their clients to say, oh, so-and-so can do a blog post for you and probably reach X amount of people. I mean, I think mining some of those lists, or seeing if marketing agencies here would be willing to share some of that, would help in terms of, to your point, Melinda, like really getting to that list of influencers that could really carry this message for us and amplify it, just certain audiences.
Yeah, I've kind of seen some examples of this with influencers. Like I saw a Google article the other day. I know TikTok's one of the biggest social media platforms at the moment, and it can tend to be, you know, somewhat addicting as people scroll through and, you know, waste time watching all these videos, whether it's a time waster or not. But there was an initiative where I think 5 to 10 influencers collaborated, and they recorded themselves taking a TikTok and saying, hey, if you've had enough TikTok for the day, it's helpful for your health to take a step away from it, you know, get some extra rest, go eat some food, go get some exercise. So if there was something like that specifically focused on exercise, I feel like influencers might be open to it. I guess that's something that might already be around, not necessarily in a region, but from a national lens.
Yeah, so maybe that's a good question. Is this being done in our region? I know. Oh, go. I was just going to say, not related to physical activity, but I've been very impressed with like the Negro Leagues Museum. Like they seem to do a really good job of getting other people to talk about the Negro League museums. And so it's not necessarily them talking about it, it's, you know, some other athlete or some actor or just someone who visited the museum. So that it's always impressive to me how they're engaging with other people. Children's Mercy does a variation on this with their parentish blog posts. These are blog posts, but they have experts, different experts within Children's Mercy write a blog post. There's a new one out right now from our own Shelley Summer. Oh, she hopped off. She did a blog post, I think it was last week, about soda and soda consumption in kids, right? And then next week, it might be something about gun violence from one of our ER docs or something, you know. It's different, it's a blog post, but it's engaging other people.
I'm still here.
Oh, you are here, Shelley, sorry.
It's one of those that was still kind of preaching to the choir ones, but there's a group that I belong to called Women Who Explore. And so people are very active in sharing different activities. There's probably other organizations that, like that as well on Facebook that talk about different activities.
And Amy, you may be able to speak to this better than me, but it seems you were talking about how social media is a different beast. One of the hardest things I think in social media is getting your audience. And so if you, for example, if we were starting a new campaign or a new, I don't know, setting up our media, our social media names, accounts, I'm trying to think of the right words here. If we're trying to set up our media account, our social media accounts, we don't yet have an audience. So then you've got to get the audience, and then you got to figure out what's your audience what's the message that's going to resonate with your audience, and then what are you asking them to do? It seems to me the social media posts that are most successful are the ones that have some sort of an ask. It's not just get 60 minutes of physical activity a day, you can do it, or any activity counts. It's more hey, here's what I did today for physical activity. What'd you do?
Yeah, no, Shelley, you're right. And I think, using the example of the Negro Baseball League, it's especially for this project, I think it's finding those folks who have those built-in audiences and having them carry the message and tie it to something that they're doing and that resonates with their audience. So, and I guess I hadn't thought that would probably be the next conversation then, like, is this something that we're asking folks to partner on, like Bike Walk KC and other organizations to carry the message, or are we all creating an account that's managed and it's like our own, like we're driving the message? That's a great point, Shelley. And I think it would be difficult for this group, for this project, to have a social media presence that hits all the different audiences that we're wanting to hit. So I think partner organizations are going to be really important to work with.
Yeah.
My initial thought. I mean, I could be persuaded otherwise, but that's just what my gut is saying. I'm just not sure how effective. Yeah, I mean, how are you going to do some tweets in Spanish or yeah, I don't know. Yeah, I think those partner organizations are going to be really critical.
Yeah. And then the next step is, how do you tell whether or not it worked? So if you've got multiple partner organizations who are sharing your message, hopefully there's a way to figure out whether or not that was successful.
I mean, that is the never ending conundrum of social media, right? How do you measure success? I'll say for Bike Walk KC, we did our first, just really through social media, a fundraising campaign, just asking for $10 to buy helmets for kids, bike helmets. And we were able to convert quite a few social media followers who had never given before, and they gave a first-time gift. I mean, that's probably the best metric that we could come up with in terms of how many people responded. So if we're using social media to promote an activity, an event, as something that drives traffic to something else that can be counted, that would be one metric that we could use for this group. Yeah, I think each initiative is going to have its own metric.
If it's just like a link for more information, but if it's a link that we're kind of owning, or you know, we can always put, you know, what's called and Amy's probably familiar with this, but a UTM code. So you know who has clicked on a particular link. So if we created a particular message about, I don't know, maybe walking in the park, and we provide our post to these various organizations, but that link in the post would have a specific code in it, and we would be able to track it in Google Analytics.
Mm-hmm. Shelley, what are your thoughts? I'm going to ask you your same question.
Well, I mean, the reality is, I don't know.
Yeah.
That's sort of why I because it seems so daunting to, you know, like when we look at our social media, when we were better at social media, you know, we would just look at, you know, how many times it was, I don't know, clicked on or opened. I don't even know the right terminology, Amy. But then I'm thinking, like what we were just talking about, in order to actually spread this, you want to ask, you either want to ask partner organizations or influencers to be able to share this message. And it's hard to do that when you don't have any money or funding. So it's hard to pay for an influencer if you don't have any funding. And so then if you have other people share the information, what's the most important thing? Sharing the information or getting new followers? And then do you really even want to spend the time getting new followers, meaning set up, and I'm sort of making this up right now because this is not a very interesting name for a social media account, but the physical activity plan Instagram account, you know, is that really what you would want to do with social media? Or is it really more to the point Melinda was making, you just set up a way to capture whether or not people engaged? And I really love your example, Amy, about getting people to be first-time donors around a bike helmet. And I think, though, you know, what is it that's going to get people to engage? And typically it's a story and it's pain. And so, for example, somebody's diagnosed with type 2 diabetes, and then all of a sudden they decide, okay, well, that's sick enough. I'm done. I'm going to be physically active. And my doctor said, this is what one of the things I need to do. Okay, well, so now there's enough pain for them to change. They could have heard, you should be more active for the last 20 years, but it wasn't until they had enough pain to, to do something. And so again, that takes me back to, what's the message that resonates with people?
Mm-hmm.
Or it's fun.
Mm-hmm.
And I feel like there's somebody in the sports sector, Casey Crew, is that right? Okay, so they set up physical activities, like that are games and they're more for fun. It's not about kickball because it's physical activity. It's about kickball because that sounds like so much fun to do.
Yep.
Anyway.
Yeah, I think as we dig into the plan, figure out the audiences, I think some of those ideas will bubble up in terms of what the tactics are that we need to employ with social media, depending on, is it around an event? Is it around a message? Is it around an invitation to something, an engagement piece, a share your story, that kind of thing. I think we can figure it out. And some of it's trial and error. And I often think of social media as it's a cumulative effect as well. So sometimes I think it's unfair to say what's the success of one post. It's really about building on other aspects of the communications plan so that it's a cumulative impact. And sometimes it's not always possible to measure just one aspect of that.
That's a good point.
Yeah.
This is a great discussion about social media. Are there any other emerging technologies like the strategy calls out? I don't know what that means. Let me actually look a little bit more in depth at the national plan. Maybe they talk about and their tactics that a little bit more, but
Is that the TikTok?
I think that would be
it's-
considered social media, right?
Yeah, it's,
I guess I'm wondering if like emerging technologies is like, I don't know, this is not emerging, but like Zoom or something like that. Video conference.
mirror.
Oh, okay. So they talk about biometry. So my Garmin device, right? So for example, the Garmin Kansas City Marathon has ways to find out running training routes leading up for the marathon that you can see on global on their Garmin Connect app. During the race, of course, you can identify other people who are wearing the Garmin device. So that's an example. If for a while Strava, remember that service Strava was very popular, at least in some of my circles. People were posting their Strava exercise routes or whatever.
I like the idea of using that emerging technology to celebrate the little stuff. Like, hey, did you vacuum the house? You get activity point for that. like making people understand that you don't need to use these emerging technologies if you're a spandex warrior or someone who's doing a series of marathons. It's sort of, I guess, the idea of like getting your steps in, but I think we can do more to just make people realize that it doesn't take special effort to be active. You can look at what you're doing already and be more intentional and mindful and understand that more of that helps me get to a certain level of activity.
Yeah, you're exactly right. My dad, I got him to wear, my dad's 80 years old. I got him to wear a Fitbit for about 6 months or so, something like that. He said, oh, it doesn't work because it says I get a lot of steps when I'm sweeping. And I was like, well, I mean, that's kind of the point, Dad. You're getting activity. it though, the more you're sweeping, the more activity you're getting.
Exactly.
But he didn't make the connection. He thought it was a bad device, you know,
That's funny.
because it was never communicated to him in that way.
Kind of going back to the Culture Fest, how cool would it be to show up and have everyone wear a Fitbit or whatever and actually record and put value on, at the end of that dance, this is how much physical activity you achieved doing something that you absolutely love, that was beautiful to watch, that is culturally significant, and like help people quantify those things. That would be kind of cool.
That's exactly right. And I think kind of to maybe the point of the strategy is a lot of these devices can do those things already, that they're just not, people either aren't aware of them or they don't understand that they can do those things. So communicating that the opportunities there.
Well, yeah, it's about valuing movement in the same way that we value someone running a marathon or riding. I mean,
Right.
it's about the value we put on types of movement.
Right. Yeah.
I'm going to throw this out here because Laura Steele, our director of education at Bike Walk KC, we've talked about what would it take to get schools to grant physical education credits for students to volunteer and do yard cleanup for a neighborhood or for an elderly neighbor, or it just seems like that kind of idea could fit into this somehow. Tying, community service to physical activity, and for kids especially, getting some sort of credit or something in the end. And so when you, at an early enough age, when you can marry those ideas together, physical activity doesn't become, or movement doesn't become, the separate thing that you have to engage in. You can think of it in terms of a larger good, perhaps.
That's a really good point. And Shelley supports the healthy schools sector. And I know one of the big strategies for the healthy schools is implementation of the comprehensive school physical activity plan. Am I butchering that? I always forget what that's called. But I believe one of those criteria or guidelines is kind of the better PE, where you're not less focused on sports-based activities, but more on, life and long-term lifestyle activities. Maybe there's some link there.
So I don't know if that fits with emerging technologies, but it's
right.
Yeah.
And also in that emerging technologies, if partners that we would work with, if they would have any type of texting program that they could text out healthy reminders about moving and just activity in general.
And there are some people at Children's Mercy that are doing some of that work for research programs, with different types of messaging in different settings, different times of day, things like that. It's a really hot topic. And in fact, is it this Friday? We're having a visiting speaker to talk about that, actually. Yeah, Friday. Maybe, I'll say it's beyond behavior change, rethinking our scientific approach for cultivating health and sustainability, from this person who does a lot of interactive prompts exactly like that. Maybe I'll, if it's possible, I'll share the link with everyone here in case you're interested and you can hop on Friday at noon. I don't know how to share it with people, but any other, so we've got 15 minutes left in our time. And I do want to allow time for just general open discussion on things and discussing the next steps. But anything else on this strategy that we need to discuss?
Do you feel like we've overlooked anything, Robin? I mean, how does this resonate with you?
I'll be honest with you, it's always a little bit hard for me to tell at this point until we start getting into our tactics. Because they're more, when we start talking exactly like what we might do to accomplish this strategy, then I start seeing like, oh, we're missing this key person, or there's that big barrier. So at this point, I'm feeling pretty good, but I do think we'll think of new things in our next meeting. How about anyone else?
I think you're right, Robin. And I also think, I can't see it on there right now, but there's a part about, who are we missing? And I think as people that we might be missing join the group, I think some of that will also come out then. I mean, for me, I don't know what I don't know.
Bryce, how about you? Anything? Think you've done a great job collecting all of these thoughts. Anything you think might need a little bit more clarity, or?
No, I think we can, like you said, Shelley, identifying who we're missing, and then I think that's, linked to how we can tailor this for our region, and maybe, try to utilize some of the individuals or organizations that have a good grasp on connecting to these audiences. So I think we'll clarify that a little bit more in our tactics, and I'm sure that, a couple of the tactics will fall right in line with what we want from that. So this might be a very important strategy, especially where we're at with social media trends and such. And maybe we'll have to look to some, younger individuals for platforms like TikTok and things like that. So I think everything's kind of on the table with this strategy.
Great.
And after the holidays too, we can kind of regroup with our original group that could add some more input. I know there's still a lot of people out maybe this week. I know there's a lot of people still out at my company extended their Thanksgiving holiday. So
yeah, so this is a good segue, I guess, to our next meeting. So we've kind of have the schedule of the last Tuesday of each month is when this group meets. The last Tuesday of next month is going to be Tuesday, December 28th. I know weighing in is taking that entire week off in between Christmas and New Year's. And so I think our consensus is that we would like to just skip the December meeting and meet in January. It's kind of a big gap between meetings, but like you said, there's a lot going on and people's time and minds are often elsewhere. So I think it's probably okay. Does that sound good to everyone? So the next meeting would then be Tuesday, January 25th.
That would work for me.
What would you need us to do in that 2 month, that time frame, Robin? What could help this process? Just
Yeah, I mean,
individually.
yeah, that's a great question, Toriano. I think that will this mural board will remain open to everybody. If so, maybe if you have time, just review it. Just think about, if there's anything that you would like to spend a little bit more time talking about. But otherwise, I know for me, I just have been trying to be more aware of things that are currently happening, either locally or nationally around mass media and physical activity. And so like I kind of have a list that as I see something, I write it down and try to bring it up at this meeting, such as that link that I shared at the beginning. So I would say just kind of be aware of what else might be going on, and then we can talk about it in more depth in January. Does that
Thank you.
make sense?
Absolutely.
And everybody has to write a 10-page
No.
summary.
No.
Toriano goes first.
I haven't done homework in 20 years. I'll pass.
Okay. In our last couple minutes, does anybody have anything coming up that you'd like to share with the group? Any events or any other projects you're working on that you think others might be interested to learn about?
I hate to toot my own horn here, but I might have to, because who's going to advocate for you if you're not going to advocate for yourself? I'm going to drop my first audio book here pretty soon. I took time out over the last 2 weeks to visit the studio and, lay my tracks down. As the rappers would say, I murdered that mic. So look forward to that. It's going to be out within the next 2 weeks. It's my first one. I'm looking forward to it.
What's the book?
Okay, so the title is called The 5 People You Meet in the Hood Before You Get to Heaven. It's 5 personal essays about the closest people that I lost to me within a 19-month span. So it's a tale of redemption, reconciliation, and coming to grips with their depths. I wrote a ebook last year for Black Friday, put that out. It went #1 on Amazon. So this year I decided to do the audiobook version of it. So just trying to take my storytelling to a little bit different level and separate myself from the star a little bit as far as my creative work.
Nice.
Great, thank you. And of course, I think we've all read his editorial work with the Star. I'm really digging his books that he's authored. The Pride of Park Avenue, I'm making really good progress on, and it's an enthralling book. So
thank you. Thank you.
Congrats, Toriano.
Thank you. Thank you.
Yeah, that's awesome.
Hey, Toriano, what's that going to be released on, the audio version of that?
iTunes, Amazon's Audible, and one more platform.
Awesome.
I can't. It's 3 of them though. iTunes, Audible, and one more. I just can't think of the name offhand.
Great.
Great. Anything else going on? And maybe I'll let Shelley share about the quarterly meeting that we're hosting next week, and if we have a link for that.
Yeah, we have registration somewhere. I'm gonna have to find it really quick and see if I can't drop it in the chat.
Okay.
But our weighing in quarterly meeting is Thursday, December 9th from 9 to 11. Our speaker at that meeting is Dr. Kylene Kong. She's a researcher at Children's Mercy who focuses on obesity prevention in infancy. It's going to be a really interesting talk. It's not as directly related to physical activity as you might think, but I do think she brings in a little bit of activity that's appropriate for infants. She's really talking about, well, actually, I don't know exactly what she's going to be talking about during that meeting, but what I've seen her talk about in the past is like environmental cues and how infants respond to cues related to feeding. So we're really excited to have her present. We'll be giving updates on the physical activity plan, and so we'll share where this group is in terms of developing strategies and tactics. And let's see, we were just talking about this morning. Anyway, I invite all of you to participate in that. We're really excited to host that one. Yeah, as I'm trying to find our registration link and share updates as well. So that's our next meeting.
I've seen Dr. Kong give this presentation before, or at least a variation of it, and it's amazing. One, she has lots of really cute videos of babies, like little babies, responding to cues, food cues, toy cues, things like that. And it's hard to believe, but behavior starts that young, that continues through the rest of your life. So really cool stuff. And there may be a very cute video of my little baby girl with an activity monitor on. So
Awesome.
yeah. Anyone else have anything that they want to mention?
Well, we have our Bike Walk KC giving campaign coming up soon. So if you want to support healthy lifestyles of biking and walking in Kansas City, you can donate to us, and we'll have links soon.
We are working on them. Yes, Robin and Melinda are board members, and we've roped them into helping with that campaign. So there's some really cool stories coming out from our board member perspectives about staying healthy and staying active in Kansas City. So
Absolutely. Okay. Well, thanks everybody for participating. It's a small but mighty group. This is, I don't want anyone to feel discouraged that we don't have 25 people at these meetings. This is often how this process goes. This is, very much the planning phase, which a lot of people aren't interested. They just want to do, and that's great. But this is a critical step in that process. So thanks for joining us. Thanks for contributing. It's a great conversation. I enjoy listening to all of you experts talk. So Melinda, and Toriano, do you have anything you'd like to share just before we check out?
Just absolutely, just echoing on what you said. We want to thank you guys for taking the time, not only showing up, but participating, offering your ideas. And again, me and Melinda, we're just co-leads. We're in this together. So thank you guys for continuing to show up and taking time out of your day. We understand how important it is that you guys have things to do, but to spend an hour or so with us and contributing is really appreciated.
you guys make it easy.
Yeah, definitely. Great conversation today. And again, like I said, well, I think with the new year and getting over the holidays, we'll probably have a few more participants, because I know I've had some people reach out to me that definitely want to be involved. But I think once we get out of this holiday mode, we'll be able to re-engage some people again as well.
Definitely.
Yeah,
But
absolutely.
we really appreciate it.
Yeah, great. All right, so we'll send out the meeting recap in the form of a newsletter. Bryce usually will send that out next week, sometime midweek. And that'll also include the link to registering for the January meeting. So if we don't see you before then, have a great holiday, and we'll see you in 2022.
See you.
Thank you.
Yeah, everybody.
Yes, thanks.
Bye.
Bye.